Most people waste this part of their clinical internship. If you're a psychology student doing your internship, chances are you're observing a therapy session and not doing the therapy. Here's how you can actually learn something instead of just sitting and observing. First off, yes, you'll be sitting in on real therapy sessions and it's not always as dramatic like you see in the movies. Trust me when I say this, there's a lot to learn if you pay attention. This one surprised me too. I was told not to take notes during the session and it makes sense. Imagine you're the client, the therapist already has someone else sitting in the room and now they're taking notes too. It's distracting. So stay present, take mental notes and jot things down after the session. Sometimes you'll get the client's file beforehand and that provides you a background of the case. But if you don't, it's fine too. You walk in with a blank slate, then after the session, compare your observation with the actual file. It's kind of like a mini diagnostic exercise and it's honestly a great way to test your clinical intuition. Once the session ends, that's your time. Go to your therapist, have a discussion, ask about the choices they made, like why didn't you go deeper on that point or why use that specific technique here. This helps you understand the why behind the techniques they used. If you're watching a psychological assessment, pay a little extra attention to the instructions here. What the therapist says, how they say it, what the client is allowed to and not allowed to do. I usually ask things like how do we decide between different personality assessments like the MCMI, thematic perception test or Rorschach. Because honestly, it's not just knowing what test exists, but when to use them and why. You're not just watching, you're training your clinical eye. That's what makes the observership so powerful. If you found this video helpful, don't forget to subscribe and click on the bell icon so that you don't miss out on the videos that I post.